try not to. Good afternoon and welcome to Assembly Committee on Commerce and Labor. Committee Secretary, will you please take roll?
Assembly members Anderson, Carter, Cole, Hardy, Howdigi, Kasama,
Here.
Miller, Monroe Moreno, O'Neill, Roth, Torres Fawcett, Yeager, Urick, Chair Marzola.
And I am here. Please mark members present once they arrive. Welcome everyone here in Carson City with us, those watching us in Las Vegas, and anyone tuning over the internet. Today we are going to hear two bills. I understand that we did have three bills on the agenda. AB 341 has been taken off the agenda today. So we will be hearing Assembly Bill 259 and Assembly Bill 340. I will not be taking those in order. Before we get started, I do have a few housekeeping announcements. Members of the public may provide testimony in various ways, which are all listed on the agenda. When testifying, please remember to turn on the microphone to speak and off to listen. If you have handouts for the committee, please provide 20 copies to the committee secretary prior to your testimony. Committee information is available on the legislature's website. You may also watch our meetings through the legislature's YouTube channel. We ask that public comments be kept to 2 minutes each so that everyone can be accommodated. I expect courtesy and respect in all our interactions, even if we may not agree. Please remember to turn off or silence your electronic devices, especially your cell phones. Also, with our two bills today, I will be limiting testimony. I'm going to do 30 minutes in opposition, 30 minutes in support, and 30 minutes in neutral. 10 minutes here in Carson City, 10 minutes in Las Vegas, and 10 minutes on the phone. And with that, I will open the hearing on Assembly Bill 340. This measure requires health insurance to cover certain screening, assessments, and diagnosis. Welcome, Assembly Member Ohrenlicker. You may begin when you're ready.
Thank you, Chair, and good afternoon. I'm Assembly Member David Ohrenlicker, representing District 20 on the southeast side of Las Vegas. Thank you for the opportunity to present Assembly Bill 340 on behalf of the Assembly Committee on Health and Human Services. AB 340 will help us do a better job of identifying children with significant conditions that affect their mental and cognitive health, and that will help ensure that the children receive the early interventions that are critical to their long-term well-being. Joining me today to discuss Assembly Bill 340 is Dr. Tara Raines from the Children's Advocacy Alliance.
Thank you, Assembly Member. Good afternoon, Chair Marzola and members of the committee. My name is Tara Raines, and I am Deputy Director of the Children's Advocacy Alliance. I'm also a licensed psychologist here in Nevada. At the Children's Advocacy Alliance, I oversee policy initiatives that are related to children's health, early childhood, and child welfare. And today we're going to talk about AB 340, which is a critical piece of legislation to strengthen our ability to identify and provide early intervention supports for children in Nevada. At CAA, we build coalitions so that we can learn more about what the community needs, what the community wants to advocate for, and so that we can really target our efforts. And this bill was born from our Children's Mental Health Action Coalition. And that name was intentional because the people who are a part of that coalition are ready for action. They're tired of discussing Nevada being in the bottom when it comes to children's mental health. And so what they saw as a need is mandating screening and assessment for common disorders of childhood be covered by insurance companies. We know that we have a youth mental health crisis, and we don't have a clear understanding here in the state of how many kids are actually suffering because we don't have that screening data, which gives us that information and that data. Access to early interventions and access to screening and assessments can change the trajectory of a child's life because it allows us to see where they're struggling sooner rather than later and intervene at that point. AB 340 is designed to improve access to these. It ensures children receive timely and appropriate mental health screenings to detect disorders. It also integrates mental health assessments and screenings into pediatric and other primary care settings, which would make it easier for families to access that care. It reduces cost, right? Like, we know that these assessments can cost anywhere from $3,000 to $5,000 out of pocket. And for many of our families, that just isn't feasible to get the assessment done. And we also know that our insurance companies require the diagnosis from the assessment to cover the services that subsequently are needed often for these children. And so we're asking for your support. We see mental health as just as important as physical health, and AB 340 is a significant step forward. And we need to continue to work so that the children have access to care. So we are asking for your support. Thank you.
Assemblymember, does that conclude your presentation?
Do you want to? Okay. Yeah, I'm comfortable. Okay. So the specifics of this bill include making sure that Medicaid and all insurance in Nevada cover screenings and assessments for ADHD, fetal alcohol spectrum disorders, intellectual disabilities, and learning disabilities, because these are among the most common disorders of childhood mental health disorders. And also it ensures that children are able to receive coverage for evaluations up until age 22 if they're still in high school. What we find is we have youth with intellectual disabilities who are still in high school up until 22, and they may need reevaluations for services beyond high school, and that parents are having to come out of pocket for those evaluations because they're also not covered by insurance carriers. We know that the impact of this bill includes reducing emergency room visits, a decreased need for special education services, and also improved outcomes and performance. Are there any? Yes.
Can you guys go through the bill section by section? Thank you.
Yes. Sorry. Okay, Section 1 describes insurance having to offer policy coverage for screening of the disorders that we discussed earlier. It also talks about that the benefits, I apologize. I'm just super nervous. Thank you all for understanding.
No, that's okay. Take your time. We have time, so no
Okay.
need to be nervous.
Okay, go ahead, sorry.
Yeah, the main thing is now to say to insurers, and there are several sections that are parallel because there are different kinds of insurance. So it's to make sure we cover the health maintenance organization and the fee-for-service plans and the Medicaid and all the other plans that are out there. But they all do about the same thing, and to say that we want you to cover for screening and assessment for attention deficit hyperactivity disorder, ADHD, fetal alcohol spectrum disorders, intellectual disabilities, and specific learning disabilities. As Dr. Rain said, under the age of 18, and if they're still enrolled in high school until age 22. So that's the main part, is to say that we don't have to wait until they start to show signs, and we want to catch these children early so we can then intervene early and provide the treatment that'll benefit them and give them better outcomes in the long term. So I think that's the...
We also want to mention that we.
Can you say your
I'm
name
sorry.
first, please?
This Tara Rains for the record, Chair Marzola. Apologies. We also want to mention that we are working on amendments with a few stakeholder groups that they've brought to our attention, and we will be getting those submitted after the hearing.
Great, thank you, and thank you for your presentation. Does that conclude? Are you ready for questions?
Yes, please.
Perfect. Committee members, Vice Chair Howdigi.
Thank you, Chair. And just one quick question. I know that the language calls for certain health insurers, so I'm assuming it's meant to encompass everyone, like private insurance groups and also state-run insurance.
David Orentlicker, that's correct.
Okay, thank you.
Assemblymember Cole.
Thank you very much for the presentation, and thank you, Chair. So my question, I guess it's really for all of the sections, but I'm looking specifically at Section 7 on page 6 at the moment. This chapter of NRS 695B is on nonprofit corps for hospital, medical, and dental services. And my question is, in your subsection 2, where we talk about these benefits are required, are made available to an insured through a provider of health care who participates in the network plan. So does that mean every provider has to do these assessments, including dentists? Or does it mean that a network has to have at least one provider that does the assessments? Or how does that work in practice?
Tara Rains for the record. The intent is that every network have at least one provider who can offer these services. We do not, there's no expectation that dentists or folks who are not licensed to do so would participate in these assessments and screenings. Thank you.
Assemblymember Hardy.
Thank you, Chair. Thank you for this bill. I have known personally, some children that could probably benefited from additional screenings, and to your point, how expensive they are. A lot of parents just can't do that. So my question is just basically, if you're a parent, caring for a child or whatever, and you would like one of these screenings, are they offered, how would you know, are they through a psychologist or your pediatrician, or just generally how do you go about getting one of these?
Tara Rains for the record. Thank you for the question. There will be a number of avenues that folks could pursue to get the screenings. We're hoping to see an increase in screenings in schools. We also know that they are part of pediatric well checks in many states, and we do have pediatricians here today to support and say that, yes, this is something that can be done in a pediatric office. Thank you.
Committee members, any additional questions? I don't see any. We will begin with testimony in support to Assembly Bill 340. Is there anyone here in Carson City who wishes to testify in support? Please remember to state and spell your name for the record. You each will have 2 minutes, and then once you're done testifying, if you can get up so the next person can come, that would be great. You may begin when you're ready.
Hello, committee. I'm Dr. Terrence McAllister, T-E-R-E-N-C-E, M-C-A-L-L-I-S-T-E-R. I am the president of the Nevada chapter of the American Academy of Pediatrics. I'm also a practicing pediatrician in private practice in Las Vegas, and I'm speaking today in support of this bill. The bill actually covers a number of different things, and some of them were brought up in the questions, the difference between screening and assessment. So for these problems, primary care pediatricians can screen for all of these things in their office. Some of them take a little bit of time, and so there needs to be some compensation for it because it takes us away from other things that we're trying to get done in the office, but the screenings can all be done there. Assessments can be more difficult. Some of these are very complicated with a lot of overlap between intellectual disabilities and ADHD. They can coexist in the same person. They can exist completely separately. ADHD is not necessarily related to intellectual disability at all. So there's a lot of overlap and a lot of intricacy in making these appropriate diagnoses, and making the appropriate diagnoses is important to make the appropriate treatment plan. And as a pediatrician, it's in my blood to screen and to prevent. That's what pediatricians do. We would much rather prevent a problem than treat a problem. And in order to prevent a problem, you have to know it's there. And so that's where screening is important. Thank you.
My name is Leanne McAllister, Leann McAllister. Yes, we are related. I am the Executive Director of the Nevada chapter of the American Academy of Pediatrics. While some pediatricians are employed, a great number of pediatricians in the state of Nevada are self-employed. Actually, it's surprising, a third of all pediatricians in Southern Nevada are solo practitioners having their own business. And right now, even though they know Bright Futures calls for a number of screenings, not knowing whether or not the insurance company is going to pay them for taking the extra 5, 10, 15 minutes it takes to do the screening, to assess it, and then to treat it, means that sometimes they skip it because they can't risk the financial burden of providing care that doesn't get compensated. Coverage like this will now allow pediatricians to have much better forecastability of how services are going to be paid for, that they have to be paid for from all the different insurance companies. And then I have heard from pediatricians, there's nothing worse than having to think, okay, what kind of insurance does this kid have before I give the type of care that I know that is appropriate to give. So we do support this bill, and I hope you will too.
Good afternoon, Chair Marzola, members of the committee. My name is Rebecca Acosta, Rebecca for the record. Today I'm speaking to you as the Executive Director of A&J Patient Advocacy in support of AB 340. As an advocate who supports children, adolescents, and young adults, I have many clients affected by ADHD, fetal alcohol spectrum disorders, learning and developmental disabilities. These families are faced with long wait lists, extremely high costs for evaluations and treatment, and very little support if they are unable to afford such costs. With these services not covered by the majority of insurance policies, and with 6 in 10 children covered by Nevada Medicaid, families are forced to choose between meeting the basic needs of their household or spending thousands of dollars for a single assessment. Young people develop at such a rapid pace, and completing stages of growth with unmet medical needs is a problem we can and must fix. By supporting AB 340, you are providing access to evaluation and treatment for thousands of children who were previously left out. Nevada has a moral and ethical duty to ensure our most vulnerable population has equitable access to evaluation and treatment for every medical, mental, and behavioral condition. I'd like to pass it on to the next speaker, who is an advocate with me at A&J Patient Advocacy on the Teen Council, and he's also my son. Thank you.
Good afternoon, community members. My name is Talsius Carpenter. Talsies, and my last name is Carpenter for the record. I am 15 years old and live in Henderson with my parents and older brother. I'm here today to ask you to support AB 340. I was born with serious heart defects that have no cure. My heart condition also causes problems in my brain. I have ADHD, learning disabilities, and developmental disabilities. For many years, my parents had to pay for my testing and treatment. Because it was so expensive, I did not get all the testing until I was 9 years old. After the testing, I knew a little about how my brain worked and how I would have to do to learn to overcome its challenges. I started to get accommodations in school in the 5th grade, and my family found a great tutor and advocate for me starting in 6th. Once I had the help that my brain needed, I was pretty successful. This year, I'm going to be in high school for computer programming and cybersecurity. I still have my education tutor and neuropsychologist to help me. My parents are still paying thousands of dollars every few years for testing. AB 340 will make insurance companies cover this testing so that other kids don't have to wait years to get help, and their parents won't have to pay thousands of dollars. I wish this law was in effect when I was a kid, and I hope you support it. Thank you.
And I want to say thank you so much for coming here today. I know this can be a scary room sometimes, but we appreciate you sharing your story, and you testified perfectly. Thank you.
Good afternoon, Assembly Committee members. My name is Noelle Paik, and I am a teen co-chair for Hope Means Nevada, a local nonprofit dedicated to ending youth suicide in Nevada. I'm here today to express my strong support for AB 340. Suicide is one of the leading causes of death for teens in Nevada. Too many young people struggle with their mental health in silence, without the support or resources they need. I know this firsthand, as I've personally struggled with my mental health from a very young age, and one of my diagnoses is ADHD. I was fortunate enough to have the support of my parents and access to mental health screenings early on. Because of this, I was able to receive the care and resources I needed before my struggles became overwhelming. Unfortunately, not every child has that same opportunity. Early detection of mental health conditions such as ADHD, spectrum disorders, and learning disabilities is vital. It allows for early intervention, proper treatment, and the ability to address challenges before they become crises. Without proper screening, too many young people go undiagnosed, causing them to struggle alone until their mental health worsens. That is why insurance companies should be required to cover mental health screenings for all youth in Nevada. No child should be denied the opportunity to get the help they need simply because their family cannot afford it. AB 340 ensures that more young people receive the screenings they need to get timely support, giving them the best chance to thrive. This bill is not just about policy, it's about saving lives. I urge you to pass AB 340 and invest in the mental well-being of Nevada's youth. Thank you.
Good afternoon. My name's Tara Borsch, Taraborsh. I am a licensed psychologist in Las Vegas and also the director for Boys Town Behavioral Health Clinic. This is the center of what I do day to day. It has been very frustrating working with families and trying to get assessments covered by insurance companies, especially when they put a age restriction. Therefore, it limits their ability to get the interventions and treatments that they need to be successful. Early intervention would help them to be ready to start school and to address areas that the school may not be able to do. So I urge that AB 340 be considered and passed where insurance companies are mandated to coverage for screening and assessments for all ages. Thank you.
Good afternoon, Chair and Committee. My name is Sabrina Schnur, Sabrina Schnur, and I am here on behalf of the Nevada Psychiatric Association and the National Alliance on Mental Illness Nevada chapter. We are just offering a ditto today. Thank you.
Thank you. I'm going to pause Carson City for a minute. I don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
Testify in support for Assembly Bill 340. Please press star 9 to take your place in the queue.
Good afternoon, committee chair and members. My name is Luisa Benasano. For the record, Luisa Benisano. I am the Campaigns and Community Engagement Manager for Planned Parenthood Votes Nevada, and we support AB 340. Thank you.
Chair, the lines are open and working, but we have no more callers to testify in support at this time.
Thank you. We will come back to Carson City. You may begin when you're ready.
Thank you so much. Good afternoon, Chair Marzola and members of this esteemed committee. My name is Catherine Nielsen. I'm the Executive Director of the Nevada Governor's Council on Developmental Disabilities. We do support the expansion of coverage for a multitude of reasons. Everything you've heard today, I will ditto those. Early screening leads to better life outcomes while minimizing future costs associated with more intensive interventions. So we wholeheartedly support this. Thank you.
Hello, committee members. My name is Grace Paik, and I am Noelle Paik's mom. I'm here just in support of AB 340. As you heard from her before, it was very costly to get her diagnosed early on, and I feel like it's very important for insurance companies to cover this. I think it's just as they cover physical well checks, this is the same thing. You know, mental well checks are very important because all the mental health issues that children face early on also it becomes physical issues as well. So I'm here just to support AB 340. Thank you.
Hello, Chair Marzola and members of the committee. My name is Taylor Quinn, Taylorquinn. I am currently a Youth Connections advocate with Raise the Future. However, I am also coming to you today as a licensed social worker in the state of Nevada. I have worked with hundreds of kids throughout my career. During my time at Raise the Future, I have had the joy of seeing the success of early diagnosis and intervention. I want you to take a moment to picture a young boy with big glasses, messy brown hair, and he's holding his favorite yellow Hot Wheel car. For today's sake, let's call him John. John entered foster care a few years ago as a young child with his two other siblings. Due to parental rights being terminated, we are now searching for his forever home. John was diagnosed with in care. And due to the services he is eligible for, he has successfully maintained living in a home setting for almost 2 years. He has reached milestones like tying his own shoes, participating in homework, and making his favorite a PB&J. If he did not receive an assessment as early as he did, his life would look very different. Through getting appropriate services early on, he has avoided being institutionalized or cycled through facilities and incurring more trauma in that process. Due to having resources that help maintain stability in the home, I have been able to meet with him monthly and work on adoption readiness with him. I have also been able to have conversations with families about permanency that provides the whole picture of John and his behavioral and mental health needs. This bill will allow every child in Nevada to experience that level of care, and that's what they all deserve. Thank you.
Good afternoon, Chair Marzola, Vice Chair Hadigi, and members of the Assembly Commerce and Labor Committee. My name is Jacqueline Nguyen, Nguyen, and I represent the Nevada State Medical Association, the oldest and largest organization representing physicians in our state. NSMA is committed to providing comprehensive preventative care for their patients. Screening for ADHD, fetal alcohol syndrome, fetal alcohol spectrum disorders, and other disabilities are important to improve the quality of life and long-term health of patients. Screening and diagnoses for these disorders are critical steps in ensuring that children and individuals receive necessary support, leading to better developmental, educational, and emotional outcomes. Therefore, we are in full support of AB 340. Thank you.
Good afternoon, Chair Marzola and committee members. For the record, Leonardo Benavides with University of Nevada, Las Vegas, here proudly in support of AB 340. I just want to echo a lot of the sentiments that were shared here today. I just want to highlight briefly the work of Dr. Michelle Paul and the practice, our evidence-based mental health care clinic that serves the community. This would be a great service and additional screenings for our children in the community. So thank you to the Children's Advocacy Alliance and to Assemblymember Orrin Lichter for bringing this bill today.
Is there anyone else in Carson City wishing to testify in support? I don't see anyone. We'll move to testimony in opposition. Is there anyone here in Carson City wishing to testify in opposition to Assembly Bill 340? I don't see anyone. I still don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
Chair, there are no callers to testify in opposition at this time.
We will move to testimony in neutral. Is there anyone here in Carson City wishing to testify in neutral? Please remember to state and spell your name for the record. You have 2 minutes each.
Thank you, Madam Chair, members of the committee. Adam Plain, Plain, with the Nevada Division of Insurance. Just to state again, we did submit written testimony. We evaluated the bill for federal defrayal possibilities and have determined that under current analysis, this bill does not look to trigger federal defrayal provisions, so there should be no fiscal note added for that possibility. I did want to mention briefly, if I may, Assemblymember Cole had asked a question about 695B provisions, and our initial analysis of the bill coincides with that of the bill presenters, that the language used would require that a health insurer or other organization have the ability for a policyholder to receive care in-network, not that every in-network provider receive the care being mandated. And if there's any questions, I'd be happy to answer.
Good afternoon, Madam Chair. For the record, Ryan Beeman, B-E-A-M-A-N, representing the professional firefighters of Nevada. We come up in neutral. We appreciate the bill sponsor, along with the Children Advocacy, working with us to address some of our concerns with regards to our self-funded, self-administered nonprofit health plans. And thank you.
Ashley Kennedy, representing Clark County, last name spelled Kennedy. I appreciate the bill proponents working with us. Clark County, we also manage a self-funded health plan, and so we appreciate their time in working with us. Thank you.
Thank you, Chair Marzola, members of the committee. My name is John Abel, John Abel, representing the LVPPA and Las Vegas Metro's Health Trust, echoing Ryan Beeman with a ditto. Thank you.
Thank you, Chair Marzola and committee. For the record, Nicole Flangus on behalf of the Nevada Association of Health Plans, a statewide trade association representing 10 member companies that provide commercial health insurance and government programs to Nevada. While we appreciate the intent of this legislation, mandates often come with unintended consequences that drive up costs to consumers and reduce plans' flexibility. These increased costs ultimately translate into higher premiums, deductibles, and out-of-pocket expenses. Additional mandates can limit consumer choices by requiring all policyholders to pay for the coverage. As an association, we remain committed to enhancing healthcare quality and accessibility and welcome the opportunity to continue to collaborate on policy solutions that align with the goals of this bill and ensuring Nevadans have access to affordable and sustainable healthcare coverage.
Is there anyone else in Carson City wishing to testify in neutral? You don't have to run.
Hello, Chair, distinguished members of this committee. My name is Troy Krumey, Troyce Krumme. I'm the current chairman of the Las Vegas Metropolitan Police Department Police Supervisors and Managers Association. I'm also the current vice chairman of the LVMPD Health Trust. I'm going to say ditto for the reasons before me or why we are in the neutral. Thank you.
Thank you. Is there anyone else in Carson City wishing to testify in neutral? I don't see anyone. I still don't see anyone in Las Vegas broadcast. Is there anyone on the line?
Chair, there are no callers to testify in neutral at this time.
Thank you. Assembly member, would you guys like to come up and give some final remarks?
Hello, Chair. Tara Raines for the record. I just want to point out that as far as mandates for screenings and assessment goes, we do this for autism spectrum disorders. NRS Chapter 287.0276 requires screening, assessment, and treatment for kiddos with autism spectrum disorders. We've been intentional, and we know that if we were to add the treatment aspect to this bill, that it would be costly. And we need a better idea of how many kids in our state need this support. And so this screening and assessment allows us also, from a public health perspective, to better understand the needs of Nevada's children. So we're grateful for you and your consideration. Thank you.
Thank you for your presentation today and bringing this bill forward. Like you, I think we could agree that having these assessments for the children are very, very important, and it's, a huge reason they will be able to succeed in the future. So thank you. And with that, I will close the hearing on Assembly Bill 340. I will now open the hearing on Assembly Bill 259. This measure establishes provisions governing prescription drugs. Assemblymember Considine. Welcome. You may begin when you're ready.
Good afternoon, Chair
Chair Marzola and members of the committee, I am Venetia Constantine. I have the honor to represent Assembly District 18, and I thank you for the opportunity to present Assembly Bill 259 to this committee today. I brought this bill in 2023, and in 2023 it was AB 50. It passed out of the legislature, but it was vetoed by the governor. I'm bringing it back this time in essentially the same form, and it's now AB 259. AB 259 is about people. It's about taking an opportunity to provide relief to those Nevadans who are dealing with significant health issues. Most, if not all of us, have dealt with life-altering health issues, whether personally or with.
I think your mic turned off, but mine keeps flashing, so I think we're having issues. So you may just need to keep pressing it.
Okay. Make sure I can see the light. This isn't an issue that people can't relate to. It's an issue people are dealing with every day. I've had numerous conversations with stakeholders about this bill last session, throughout the interim, and even some conversations in this session. But the story hasn't changed. Manufacturers, pharmacy benefit managers, insurance companies, and others in the chain all agree that prescription drug prices are too high. But discussions on how to bring those prices down turn to finger pointing. It's not us, it's them. Or they, fill in the blank according to who they're directing your attention to, have too much influence and our hands are tied. Or we should start with transparency bills, or changing rebate schemes, or change healthcare deductibles, or provide copay assistance programs, or call the number in the commercials to get your prescriptions for free. The conversations eventually turned to a listening session on the difficulties of being a drug manufacturer or a pharmacy benefit manager or an insurance company. They explained that it's hard to understand the realities of the prescription drug market. They worry that changes will lead to the loss of profits. Then it changes to, it will cause the end of private research and development. It will lead to cost shifting, which is essentially, if we can't make that money on this drug, we'll just raise the price of this other drug over here to make up for it. They say they'll be forced to stop providing prescription drugs in Nevada, that people will go without their necessary medications, that they can't provide the same cost for the same prescription drugs that they sell in foreign countries because other countries make them charge that amount if they want to sell their drugs in those markets. And then they have to make up for that here in our country, or they just won't make new drugs. We've tried bringing various bills and nothing has changed. Prices are still too high. Vertical integration has expanded, which includes the insurer, the pharmacy benefit manager, their provider, and some specialty pharmacies, owned or partnered together. But they're still unable to solve this problem. I understand that people are scared. I understand that other industries are scared. They're hearing what I'm being told, that Nevada will be cut off, that drug research will stop, that without markups, rebates, opaque deals that result in hundreds of different prices for the same drug, that sick people will suffer. I understand their worries. But when do we stand up to bullies? Right now, we're talking about 10 drugs. Not every prescription drug made and on the market. 10 drugs in 2026. I see commercials for more than 10 prescription drugs on a daily basis. It's 10 drugs in 2026. 15 in 2027, 15 in 2028, and 20 in 2029 and beyond. People are just trying to stay alive and not go under because they can't afford to pay their bills, buy food, and buy their life-saving medication. AB 259 is about Nevadans of all ages. The bill is designed to reduce the cost of certain high-cost, non-competitive, life-changing drugs by extending the benefits of federally negotiated Medicare drug prices under the Inflation Reduction Act to Nevadans who are not on Medicare and need these specific life-sustaining drugs. While the more than 565,000 Nevada seniors enrolled in Medicare will soon enjoy the benefits of these negotiated prices of some of the most expensive prescription medicines, the rest of us will be left facing the full amount that the pharmaceutical companies can charge us, which can put those life-saving medications we need out of reach. AB 259 can change that by applying the negotiated prices of pharmaceutical drugs in Medicare to the Nevadans who need them. We want people to be able to live their lives. I will now go through the bill along with the amendment all committee members should have. So I want to start on page 2. I don't want to read all of the reasonings and the whys, but just some highlights. Starting on page 2, around line 18, that there was the final report of the Nevada Spending and Government Efficiency Commission that was published in 2010, that the state of Nevada would realize significant savings on Medicaid, mental health, corrections, and other programs if the cost of prescription drugs were better controlled. Jumping down to line 27. And whereas excessive prices of prescription drugs threaten the economic well-being of residents of this state, thereby inhibiting their ability to pay for necessary and essential goods and services, including housing, food, and utilities. And jumping to page 3, line 6. To protect residents of this state from the negative effects from excessive costs of prescription drugs and to protect the safety, health, and economic well-being of Nevadans, the legislature finds that legislation regarding affordable access to prescription drugs is necessary for the residents of this state to achieve and maintain good health. That is the why for this bill. Now I'll just go into the bill with the amendment. It's not a very long bill. Section 1 is a person or entity that purchases a reference drug in the state shall not pay a price higher than the maximum fair price that was negotiated between Medicare and the pharmaceutical companies. And there is a small carve-out that excludes any fee paid to a pharmacy for dispensing the drug. Section 2 is a person shall not seek reimbursement for a reference drug which is delivered, dispensed, or administered to a person in the state shall not seek reimbursement for the reference drug at a rate exceeding the fee paid to the pharmacy for dispensing that is higher than the maximum fair price for that reference drug. Sections 3, 4, and 5 are a Deceptive Trade Practice Act if sections 1 or 2 are violated. And on the amendment, I want to add something that was in the original version in 2023 but was not included in the enrolled bill, and that is the first bullet on your amendment. Provider of health coverage for federal employees, et cetera. This is an opt-in clause for other entities who are not included in this bill that wanted to join. And then under Section 7, there were a couple of definitions that were in the enrolled version in 2023 that did not make it here. That includes manufacturer and wholesaler, so I'm adding those definitions back in. And then the one part of the amendment that you don't have is in 2023, this bill was co-sponsored by Assembly Member Natha Anderson, and she has requested to be listed as a co-sponsor for AB 259. And I know there's a lot of information. I really appreciate y'all hearing this bill again, and I'm happy to answer any questions.
Thank you for your presentation. We will start with Vice Chair.
Thank you, Chair, for the question. Thank you for being here and presenting the bill. This bill is very similar, if not exact, to Assembly Bill 250 from the last legislative session. And so could you explain to us why you're bringing the bill back if the bill got vetoed?
Venetia Counselor, for the record, thank you for the question, Assembly Member Howdiggy, through the chair. The needs are still here. Part of the impetus last session was we need to wait 2 years to see what happens. Well, it's 2 years later, and we're still in the same situation. And we are the people's house, and we are entrusted by our constituents to address these needs, and this bill does that. And I am hopeful that the governor will do the right thing this time. The cost savings for Nevadans is tremendous, and this is the opportunity to protect Nevadans from being ripped off. Many residents, especially seniors, low-income families, and those with chronic conditions, struggle to afford life-saving medications. No one should have to choose between putting food on their table and paying for life-saving prescriptions. And AB 259 is a common-sense bill aimed at tackling the skyrocketing cost of medication. And I believe we should not just give up doing the right thing for the state.
Assemblymember Monroe Moreno.
Thank you, Madam Chair, and thank you, Assembly Member, for bringing this bill back. You know, there's not a lot of people who watch what we do here in the legislature, but when I returned back to my district after last legislative session, I heard time and time again from constituents that they had watched this bill, was hoping this bill passed. Once it did pass, had great hope that it would get signed into law and was very disappointed when it didn't. For those members that are currently serving that were not here last session and may not have had time to do their research, could you tell us why, what the governor's reasons was for vetoing this bill last session?
Thank you for the question, Venetia Considine, for the record. So I didn't necessarily incorporate the reasonings, but the reasonings are a lot of the reasons that I said when I was giving my presentation. Let's see, so some of them would be that it would be less likely that certain manufacturers may be able to participate in healthcare programs. It would seriously impact marketing in Nevada. It would set arbitrary price caps. These caps could restrict patients' access to medicines. It could result in less innovative treatment for patients. More important is research and development into medical innovation, with the implication being that that will stop. And then it ignores existing and potentially ongoing issues with the prescription drug supply chain. So these are the same issues we had 2 years ago. These are the same issues that haven't been fixed. And these are the same issues that I'm hearing from the stakeholders in the industries when I meet with them. Lastly, he said that AB 250 would ultimately lead to higher costs and less accessibility. So I included all of that in my presentation, but it wasn't just from the veto from the governor, it was from the industry. These are the same reasons that we've been hearing for years.
Thank you, Madam Chair.
Assemblymember Roth.
Thank you, Chair, and thank you so much for the presentation. You know, this means a lot to me. When I was knocking doors this last campaign, I think probably the number one thing I heard from my constituents is the cost of living, and that really came down to housing and prescription drug costs. So, you know, when you say there comes a time for us to stand up to bullies, I'm thinking about those people that I encountered at the doors who were expressing to me how hard it was to get by day because of the amount of money they were paying for life-saving drugs. And so with that, my question is, do we know what the projected cost savings for Nevadans would be if this does pass?
Thank you for the question, Assemblymember Roth, Venetia Considine, for the record. So as I said, there will be cost savings for the over 565,000 Nevada seniors who are already on Medicare and will get these benefits. But there is a projected significant cost savings for residents. This extension is anticipated to reduce the cost of these selected medications by 25 to 60%. For some families, we are looking at savings, 25 to 60%. I believe I sent you all some documents that show some of that. But they're also talking about savings in the thousands of dollars a year. And thousands of dollars a year, that's money that could be used for rent, for food, or simply to live a normal life and not always have the burden of rent or medical debt hanging over their head.
I know we still have several questions, but we need to reboot our system. We're having some issues with the microphone, so we are going to take a 5-minute recess. And we are back to order. We will start with Assemblymember Cole.
Thank you. I'm glad I'm first up. So my question has to do with, as I understand it, this is kind of coming off of the Medicare concept, right? So the federal government did something that affected 10 drugs in Medicare only, not anything else. And we're expanding that to now be Medicaid and all of the private insurance companies across the board. So I guess my question is, as I understand it, you know, it's taken a large amount of work and significant taxpayer dollars to stand up and implement the federal side of this, but I'm not seeing any fiscal notes that indicate how much money it's going to cost us. And I did a little bit of research here and there. At least one group is saying it's going to be $2.3 million every year to implement this and do everything that we need to do. So how do you explain that?
Through the chair to Assemblymember Cole, thank you for the question.
Please go direct.
Thank you. Venetia Considine for the record. Just to go back to the IRA, this is the setup that they've done federally is why I think that this is a much cleaner and more direct way to kind of try to take a bite out of this massive problem that we have, is under the Inflation Reduction Act. It allowed Medicare for the first time to negotiate the prices for certain drugs with the pharmaceuticals. So this is not price setting. I know that was one of the things that was in the governor's veto message. This is not price setting. These are negotiated prices. Essentially, I'm assuming the same way they do it when they sell pharmaceuticals in other countries. And because those are already set as defined amounts, that there's a maximum fair price that has been determined in a fair and negotiated manner, that to bring the cost where we're already doing it for a subset of the 565 plus thousand Nevada seniors, to bring those prices down for these 10 drugs and any ones that go further for a smaller subset of Nevadans. So when we're looking at some of these bills, some of these drugs, they're like diabetes drugs, they're heart failure drugs, they're for blood cancers, they're for the prevention and treatment of blood clots. So there's going to be a subset of the people in Nevada that are on these particular non-competitive, very highly expensive drugs that would be able to fall under this. And the sort of the straight line would be, if this is the maximum fair price that the federal government has set, that is now in Medicare, then that will be the price here. So I don't know what the cost would be to make that, but this is the easiest way, in my opinion, to get these prices to the rest of Nevadans that have already been negotiated. So I know that there were 8 or 9 fiscal notes, but only one of them had a cost on that fiscal note. And I think as we go along and get further along, I know that the governor is changing the whole setup with HHS and separating those out. So I think timing-wise, this is actually a good time to actually just build that into the new creation that he's making with the Health and Human Services.
Assemblymember Cole, did you say, maybe I misunderstood you, that you couldn't find the fiscal notes?
No, I found the fiscal notes. There was just one, and it was 1.8 million and change for the biennium.
Okay.
And that was for the PEBs only.
I just wanted to make sure you did see it was uploaded.
Thank you.
Assemblymember O'Neill.
Thank you, Chair. And thank you for the time I was able to actually type out my question. Ms. Considine, or Assemblymember Considine, I greatly appreciate your efforts to address the the price of prescription drugs in Nevada. and I commend you for your continued support of it over the years. I can relate to it on some bills that I brought back several times and been defeated on. But I need some help from you. As I understand, what you are proposing would be unique to Nevada, and no other state has enacted such legislation. Basically, it's an untested policy that has already received much scrutiny from experts, multiple fields, including patient access groups, that have said most federal maximum fair price savings plans, MFPs, will not go to the patient. Do you have any empirical data to support the intent of your bill would be successful here in Nevada? Will it work here, basically, is what I'm asking.
Thank you for the question, Assemblymember O'Neill. Venetia Considine for the record. I don't know how I quantify intent, but in the initial beginning of your question, you mentioned whether or not Nevada is unique. I have been through a few sessions now where I've heard a lot that Nevada is unique and we do things differently here. And we are risk takers. We built a town in, a very successful state in the middle of a desert, or city in the middle of a desert, in a state that was created as a state because of significant situations in the country that needed somebody to help the whole country. I think if any state is the first state to try to, again, take a bite out of a huge problem that, I've been here, this is my third session, but there have been bills before I came here trying to help solve this problem in 2017, 2019, 2021, every year. If we can start taking bites out of this, maybe it will bring everybody to the table and we can start working out the bigger problems and untying this knot. And if this is the way to begin that, I think Nevada is the best state to do it, because we're just attaching ourselves to a negotiated agreement that was made federally that will affect the states anyway.
Well, is there any data from any place that you have that can justify or give proof to the success?
To the success of what it would be, thank you, Assemblymember O'Neill, Venetia Considine, for the record. If you're talking about the future success on the number of people who would be saved, we know it's thousands of dollars, but if you want data specifically, we can get you some data. It's just we're planning for a future and we're seeing how it is.
I appreciate it. And Chair, my mic is now also flashing off and on.
Do you have a follow-up?
Thank you. I can't turn.
And if
I don't have any more questions for you.
Chair, if I can just add on to that, one of the documents that I sent to the committee actually has the list of what the list price is as compared to the negotiated price for every one of these 10. So you could use this and just, we can extrapolate from this how much the savings would be in this state.
Thank you. It's going off and on. Yeah. Thanks.
Assemblymember Hardy.
Thank you, Chair. I appreciate what you're trying to do, and since my time here, I've also worked in this space to try and lower prescription drugs, and was on the prescription drug committee a couple of sessions ago, and so yeah, it takes everybody coming together and to try to figure this out. So I'm just curious, how do you see, is there something in the bill, or how do you see this would help, like lower copays or premiums and things like that to employers or patients or people that are paying those?
Thank you for the question, Assemblymember Hardy. Venetia Considine, for the record. Well, the main idea is that the maximum fair price is the maximum price that can be paid. It does not prohibit any insurers, any programs from negotiating lower prices. It doesn't. So that's the way that is going right now will continue to go on. Just hopefully this is the maximum fair price. If they want to negotiate lower for copays, they can. But if there are some people who do not have health insurance or other people in other situations, then this would be the price at the counter.
Assemblymember Kasama.
Thank you, Chair. My microphone is working. And it is me. I have a very low voice. I've got a cold too on top of everything else. But thank you for the presentation on this. My question is for people with commercial insurance, how would you see that this would lower their prescription drug cost?
Thank you for the question, Assemblymember Kasama. Venetia Considine, for the record. I think that it would be essentially the same answer for the previous question, in that this is the maximum fair price that's been negotiated, but is the maximum fair price. I do understand that pharmacy benefit managers in some case have like 300 different prices for one drug. So I imagine that that could be possible when commercial insurers or private insurance are also negotiating it, but this could be a tool, again, for this small subset of drugs that have no competition and are significantly expensive, for them to negotiate those prices as well.
A follow-up, Chair?
Go ahead.
Yeah. So what you're saying is whether it's Medicare or Medicaid or private insurance, the rates would all be the same. Is that correct?
Thank you for the question, Assemblymember Kasama. Venetia Considine for the record. The intent is that maximum fair price that was negotiated is the maximum price that could be charged to Nevadans for purchasing or obtaining these very select drugs.
Assemblyman Yurick.
Thank you, Chair. And I also want to start and tell you that I commend you for tackling an important issue to everybody on this dais, because I think when we all knock on doors, we hear about the challenges of prescription drugs. And I will tell you, I'm still trying to learn about all of the variables that are affecting this. And so, again, I appreciate your efforts. If with the Chair's indulgence, I have kind of a two-part question, and they're related. And perhaps you can help me understand. Maybe it's just ignorance on my part. But one question I have is, it seems like a lot of these negotiated prices are done on like national, regional basis, right? With contracts that are done beyond the state of Nevada. Is there a concern or scenario in which you can envision, for example, a local pharmacy that had to pay these negotiated prices that were outside of our state, but would be limited to recovering our in-state price, and therefore they'd lose money on it? And do we then risk the potential of a pharmacist saying, I'm just not going to put that one on the shelf? And now could we potentially inadvertently or indirectly limit the availability of some of these important drugs to people that need them? And part two related to that, and again, forgive me, that's my lawyer hat kicking in, but then looking at this sort of restriction, is there any concern at all that this could implicate the Dormant Commerce Clause as having an impact on interstate commerce? So if you could address those, I'd be super grateful.
Thank you for the question, Assemblymember Yurick. Venetia Considine for the record. I'm going to go backwards. The Dormant Commerce Clause question came up 2 years ago, and that is not, from all the research that was done, that is not an issue. Talking about pharmacies. Pharmacies are sort of in the same position. I've learned a lot about pharmacies. I've spoken with pharmacies, even spoke with them about if there was a way to help them more in this bill, because they are, in many times, not on one of these vertically integrated entities that are all sort of working with each other. There are issues with pharmacies with clawbacks, with, if they're buying their prescriptions for one drug and then they're selling it for less. Selling it for less is already happening, and I know that that is an issue. This bill can't solve everything. What the point of this bill is to bring it back from what about the pharmacists? What about the manufacturers? What about them? To bring it back to what about the people that are suffering, that need these drugs and they can't afford them? What about the idea of our state's responsibility for the health and safety of all Nevadans? What about starting there and then going back towards them and saying, how do we fix this? This is a negotiated price that was done with the manufacturers and with the federal government. They couldn't do that when Medicare Part D was created in the early 2000s under President Bush, because he gave up that right and that ability to just get that in. Everyone else can negotiate. Now that Medicare can negotiate, why can't we as Nevadans say, well, if you can do it for them, let's do it for us? Now, whether or not that sparks something across the country, that's beyond the lines of this state. But this bill comes from the start and the place of how do we get people the drugs that they need? And yes, is it an issue for pharmacies that we have to tackle? Yes, probably. Is it an issue for other people up the chain and outside manufacturers? Yes, probably. But we need to start with the people, and what works for the people will hopefully fix everything else up the chain. Not easily, not quickly, but it will start the spark, in my opinion.
Seems like I'm the only one having technical difficulties. Committee members, any additional questions? I don't.
What she wants to say.
I don't move to testimony in support. Please remember, I will be giving 30 minutes for support, 30 minutes for opposition, and 30 minutes for neutral. If you are testifying in support, please remember to state and spell your name for the record. You each have 2 minutes.
Oh, thank you. Thank you. Madam Chair, I'm David Goldwater, D-A-V-I-D, new word G-O-L-D-W-A-T-E-R, representing New Day, Nevada, which is a organization that strives for economic justice, particularly in healthcare. I'd first like to thank both Assemblymember Considine and Assemblymember Anderson for bringing this bill forward. It's something that we worked on together last session as well. I also come to you in my capacity in the preamble. I was also a member of the SAGE committee that's mentioned in the preamble here, chaired by the estimable Bruce James. So we have some familiarity in the issue of prescription drugs there. And I was also a former chair of this committee, which humbly mention, I'm ranked in the top 2,000 former chairs of this committee. But one of the problems I see is that we often want to place the blame on one entity in the healthcare sphere, and that does nobody any good. It certainly doesn't do the people any good. It's not pharma's fault. It's not the PBM's fault. It's not government's fault. When we decided to have an employer-based system, we knew that there were going to be a lot of problems, and one of those problems is the price of prescription drugs. We often rely and hoped and crossed our fingers that the laissez-faire free market would solve a lot of the problems that we knew would be created by an employer-based system, and yet, in this space in particular, the free market hasn't helped us. One of the reasons it hasn't helped us is because prices can't be negotiated by the biggest buyer. This bill is pretty simple in its concept. It says that if I offered you the chance to hop on the back of the biggest, most powerful negotiator in the space, and that is Medicare, and said that the state could get the benefit
Mr.
of,
Goldwater,
yes,
if you can please wrap
the
up
state
your
could get the
statement.
benefit of the largest buyer, you would say yes to that. And the thing that makes me the most sad is when we say the state hasn't, no other states have done it. That's because they fight it in every state. And the worst excuse we have is that we don't do it because other states don't.
Thank you for your testimony.
Thank you so much, Chair and members of this committee. I'm making these comments today as just a constituent. My name is Catherine Nielsen, N-I-E-L-S-E-N. In December 2022, my 9-year-old daughter at the time, her name is Hannah, was diagnosed with type 1 diabetes. We spent a week with her in the coma learning a new life. This was a shocking enough diagnosis, but imagine my shock when I went to the pharmacy for the first time to get her insulin, only to be told it would cost more than my mortgage payment for a 30-day supply. This was just her insulin, not the other needed supplies, her CGMs, all of that. And as a mother, I chose to skip meals so that we could afford the needed drugs for my daughter. I had to get a second job as a state employee to afford this. I will fight till my last day to ensure that she stays alive. But many diabetics choose to ration their insulin in an effort to afford the astronomical costs. This has cost many, many lives. They shouldn't have to choose between basic living expenses and the needed drugs to keep them alive. And as a mother, I urge you to help us stop the prescription drug companies from financially benefiting from our misfortunes. Thank you.
Hi, my name is Maximilian Lowe, M-A-X-M-I-L-L-I-A-N. My last name is Lowe, L-O-W-E. I'm speaking in support because my late mother passed away from complications from type 2 diabetes, and she couldn't afford the $1,000 out of pocket for her insulin. And as a person who's on Medicaid, some of my medications are over $600 without insurance, and so that's why I'm supporting this bill. Thank you so much.
Thank you. For the record, Ryan Beeman, representing the professional firefighters in Nevada. First, I would like to say thank you to Assemblymember Considine for sponsoring this important piece of legislation and the chair and the committee hearing this bill. I come up here as more as a firefighter that represents and serves the community for the last 29 years, along with my members throughout the state. We see what people in the community are going through with costs of prescription drugs, drug costs are escalating almost yearly. Many seniors and those who need life-saving drugs are often making decisions to either, as some of the committee members already said, either eat, pay rent, or take the necessary drugs that their doctors have prescribed. Capping these prescription drug costs at Medicare with the negotiated rates can bring significant relief to thousands of Nevadans who are struggling to afford these medications. High drug costs can be a financial burden on patients, particularly those with chronic life-threatening illnesses who require ongoing treatment. I urge your support for AB 259. Thank you.
Thank you for your testimony. Is there anyone else wishing to testify in support? I don't see any. I don't see anyone in Las Vegas broadcast. Is there anyone on the line?
To testify in support for Assembly Bill 259, please press star 9 to take your place in the queue.
Good afternoon, Chair Marzola and committee members. For the record, Matilda Miller, that's MATHILDA Government Relations Director, Native Voters Alliance Nevada, in support of Assembly Bill 259. 2 years ago, I stood before this body in unwavering support of the original version of this bill, and today I'm back again because the need for this legislation has only become more urgent. From a young age until I was 18, I depended on Enbrel, which is one of the 10 medications that have now been negotiated. I know firsthand what it means to rely on life-saving medications, to bear the burden of the insane out-of-pocket costs, well, at least my parents did, and to watch families struggle under the crushing weight of rising prescription drug prices. We've all heard the stories, we've all seen the headlines, but for far too many Nevadans, these are not just stories, they're their lived realities. Prescription drug costs have spiraled out of control, forcing Nevadans to make impossible choices between their health, their next meal, and keeping a roof over their heads. And most importantly, thank you to Assemblymember Constein for bringing this bill back and for standing up for Nevadans, refusing to be intimidated by the talking points of those who profit off this crisis. We urge your support once again. Thank you.
Good afternoon, Chair and committee members. For the record, my name is Mark Diefenbacher. That's MarkDiefenbacher. I'm a resident of Assembly District 5. I'm testifying today in support of Assembly Bill 259. This bill allows the state of Nevada to protect its citizens from unreasonable drug prices that contribute to Americans overall paying nearly triple for the same prescription drugs purchased in other wealthy countries. These prices, originating out of a profit motive more than necessity, fuel financial stress I have witnessed myself and my own family. By ensuring drug prices are set to a fair market value following limits put forth by the U.S. Secretary of Health and Human Services, this state government can fulfill its primary duty of promoting public health and regulating industry to improve its citizens' well-being. I urge this committee to support this bill because the pharmaceutical industry can afford price caps more than Nevadans can afford industry prices. Thank you.
Chair, there are no more callers on the line to testify in support.
We will move to testimony and Please remember to state and spell your name for the record.
Is Adam Porth, P.O. And I am the I'm here today representing the Nevada Society of Health System Pharmacists. Although I appreciate and share Assemblyman Constein's desire to lower drug costs to patients, I have concern that this particular legislation will conversely lead to access.
I don't want to interrupt you. We're going to restart. like I closed.
It's just hard to find. It's a lot.
So we are unmuted if you'd like to try, but we are still having a system-wide issue.
And we are back to order. We're going to try this again. Go ahead and start again. Hopefully your microphone works this time.
All right. Thank you, Chair.
Remember to spell it.
Yeah.
Say your name.
Thank you, Chair and committee members. Again, for the record, my name is Adam Porath, ADAMPORATH. I'm the Vice President of Pharmacy at Renown Health in Reno, and I'm here today representing the Nevada Society of Health System Pharmacists, hopefully to bring you the perspective of not only the outpatient pharmacy, but also this bill would impact Medicare Part B as in boy drugs, which are the medications that we infuse at our infusion center at Renown. So again, although I appreciate and share the Assembly members' desire to lower drug costs to our patients, I do have concerns that this particular legislation will conversely lead to a decrease in access to medications for Nevada patients. I do share some of the interstate commerce concerns that were brought up earlier, given that all of the wholesalers that we deal with are not in this state. And so whether or not we would actually get the maximum fair price, I think is a question in my mind today. Another question that I have is, what is this dispensing fee that pharmacies are supposed to get? Is that on the order of cents like it is for some PBM contracts, or are we talking about actual dollars that would support the pharmacy to actually dispense that? So it's completely undefined in this bill. It's completely undefined at the federal level what that dispensing fee is going to be. Additionally, the planned federal rollout for MFP in 2026 will not have pharmacies buying directly at MFP as mandated by AB 259. Under the federal plan, pharmacies will purchase medications at their normal wholesale price. Pharmacy claims for Medicare patients will then flow to a Medicare transaction facilitator who will inform drug manufacturers of qualifying prescriptions for which to apply a rebate to pay the pharmacy that will eventually equate down the line to what the MFP is. A similar rebate scheme for non-Medicare patients is not considered in AB 259, nor do we even know if this is how everything is actually going to work next year for Medicare patients. Additionally, unlike the federal legislation and the final rule, which is over 300 pages around the Medicare price negotiation, AB 259 is silent on how to treat prescription transactions that would be eligible for the 340B drug pricing program. Extending MFP to all Nevada patients undercuts the benefits of this program to all of our safety net providers in our state and threatens to decrease access to care to our most vulnerable patients. While it's well-intentioned, I think that AB 529 as written is bad policy, and it would only lead to a decrease in access to medications if passed. I would urge the committee to vote no. Thank you.
Sir, would you be able to answer a question by one of our committee members?
Yes.
Assemblymember Anderson.
Thank you, Chair, and thank you for what you were saying. So it sounds like from what you were just talking about is that there is a way for Medicare to be able to negotiate for the prices. Why would Nevadans not be able to also be able to have that same benefit?
So, Assemblymember Anderson, may I go direct?
You can go direct. Just
Okay,
remember to say your name.
Again, Adam Porth for the record. I don't think that there's anybody that's saying that the state couldn't negotiate on behalf of the state. The question is really if you're going to utilize the maximum fair price as set by Medicare as the basis for that, that's not how the federal government is implementing the program, to say that you're going to directly buy at MFP. And so to say that that's how it's going to work in our state is going to create a completely separate system of buying pharmaceuticals that isn't being considered today. And so, when we're talking about from the hospital perspective, we're buying through the 340B drug stream, we're buying through our group purchasing organization, we're buying through MFP next year as well. And then now we're saying, and there's going to be a fourth stream, the Nevada plan, that manufacturers and wholesalers will have to figure out how to get us the drugs at the right price. So it doesn't seem very operational as presented.
Thank you, Chair. And how about we have continued the conversation offline? Thank you so much, Chair, for that time.
Great. Go ahead.
Good afternoon, Madam Chair and members. Brian Warren, B-R-I-A-N, W-A-R-R-E-N. I'm with BIO. We're a national trade association for biotech companies. And I know it's a big ask. We're here today in opposition. I know it's a big ask of you to vote no on a bill that is intended to lower prescription drug costs for your constituents, which, as you said, is something you want to do. However, while well-intentioned, as has been said, this bill would not likely achieve savings for Nevada consumers, but it could risk access. The bill misapplies the Inflation Reduction Act's maximum fair price as a cap on consumer spending, but the MFP is a cap on what Medicare can pay. It's not supposed to be a cap on what Medicare patients pay, and it was really a pay-for in the Inflation Reduction Act to help pay for out-of-pocket cost reductions for patients, which are not in AB 259. Most patients in Nevada have commercial coverage. They're paying their costs for prescription drugs based on the benefit design of their health insurance company. That's who dictates what they pay when they go to the pharmacy counter, and it's usually not the list price of the drug, so an MFP is not going to benefit those patients. I'd also like to say that the bill could unintentionally risk access, as has been indicated today. Pharmacies, hospitals, and doctors in Nevada have to buy the drugs that they get before they dispense them to patients, and then they bill someone else after they do that. Right now, they can either buy in-state or they can buy out-of-state if they're purchasing from a wholesaler that's based out-of-state or they're part of a purchasing coalition. If they're buying in-state, then, because this cap only applies in the state of Nevada, so if you're buying in-state, you might not be able to get it for less than, or you might be, if you're buying it from out of state, you may have to pay more than the MFP. So you would either not be able to purchase it, or you would not be able to purchase it, sell it for the amount that met what you acquired it for. Excuse me, I'm backwards on that one. But because of that, we fear that pharmacies, hospitals, and others would either stop purchasing some medications or be forced with the situation of having to take a loss.
If I can get you to wrap up your testimony, please.
With that, I'll just say that we oppose this bill, and we are worried that, while well-intentioned, it would have unintended consequences. Thank you.
Good afternoon, Chair Marzola, Vice Chair Hadagi, and distinguished members of the committee. My name is Jennifer Lanahan, Jenniferlanahan. I'm here on behalf of the Nevada Pharmacy Alliance. While the Nevada Pharmacy Alliance appreciates the Assembly members' efforts to address rising prescription drug costs, the bill as currently written places undue financial and operational burdens on pharmacies in several ways. We have submitted a letter that is on Nellis that's a little more robust, but I'll outline a couple things here. First, pharmacies do not set drug prices or control reimbursement rates. They must purchase medications at wholesale prices, which are subject to market fluctuations. Imposing a strict cap without ensuring fair and timely reimbursement from payers will create financial shortfalls that many pharmacies are unable to absorb. This would force pharmacies to reduce services, limit inventory, or close altogether. By extension, that will lead to medication access issues, longer wait times, and disruptions in continuity for care for patients. Additionally, the bill would allow pharmacies to be held liable for consumer fraud, though again, pharmacies do not control drug pricing, wholesaler rates, or PBM reimbursement. The Nevada Pharmacy Alliance would encourage the committee to consider a couple of options to mitigate the potential harm to pharmacies. We are more than happy to work with the bill sponsor on fleshing out some of these. One thing would be to amend the bill to require that pharmacy reimbursement align with actual acquisition costs plus a reasonable dispensing fee. Amend the bill to explicitly exempt pharmacies and pharmacists from legal actions relating to drug prices, or delay implementation of AB 259 until comprehensive PBM reform measures are put in place, as PBMs are a major driver of drug pricing issues, excuse me. Based on foregoing, we respectfully urge the committee to vote no on AB 259 in its current form unless amendments are made to ensure fair pharmacy reimbursement and protect patient access. Thank you all for your time.
Good afternoon, Chair, members of the committee, and the sponsor. My name is Kyle Piccola, Kylepiccola. I'm the Director of State Policy for Pharmaceutical Research and Manufacturers of America, and I am respectfully here in opposition to AB 259 today. We can absolutely agree that access to affordable prescriptions is critically important to Nevadans, but we disagree that this bill will accomplish that goal. First, we don't believe that the bill will lower costs for patients, and I want to tell you this, it's not because we're trying to finger point or we're trying to hide the ball. It's an honest conversation about the way that patients access their prescriptions. It doesn't address the cost-sharing obligations that patients face. That includes premiums, that includes high deductibles, which many patients are joining plans that have very high deductibles. That includes coinsurance, and coinsurance is also a metric based on the list price of the drug. So if you have an insurance type like that in the commercial market, we don't believe that this is going to lower their costs. Second, we do believe that this bill also may impact patient access. According to a January 2025 survey of the National Community Pharmacists Association, a majority of them reported that they are already considering not stocking one of the MFP drugs. 32% have already not stocked them. Another 60% are considering not stocking them. And by 2030, that's 80 drugs that patients could lose access to. And lastly, I just want to end with, again, this bill really oversimplifies a very complex federal issue that only applies to Medicare and puts it on all insurance markets in the state of Nevada. This is unprecedented, and for these reasons, we ask that you vote no and look at other ways that we know will lower prescription costs for patients. Thank you very much.
Chair Marzola, members of the committee, Liz McMenamin, Retail Association in Nevada. I'll spell McMenamin, M-A-C-M-E-N-A-M-I-N for the record. I'm here this afternoon thanking Assemblymember Considine for working with me and sitting down and having conversations about this bill. And she understands that we're coming to the table in opposition because we see as the group that represents the pharmacy the impact that this could be. I just heard it from another speaker, and so I'll reiterate this again. Until the pharmacy benefit manipulators are come to task in Nevada to do something about what they charge and how they are taking advantage of the patients, I think that pharmacy is going to continue to have difficulties. I know that there's bills out there this session. I look forward to supporting them and getting some kind of reform going, because this bill, how it's written, we feel like much of the appeal is that it's in its simplicity, but it doesn't adequately take into account how a pharmacy actually runs and functions and how they are purchasing their drugs. And again, reiterating the study that was just done in January 2024, was reading small independent pharmacies, which we have very little in Nevada, unfortunately, because of many regulations and other things in Nevada. They're closing across the nation because of the impact of these drugs. They're finding it too difficult. It's going to be too difficult. Between pharmacy benefit manipulators and other regulations that are going on, they're finding they can't compete. And as you've seen, we've had some major pharmacies that have had some issues too with having to go public or go private and try to recoup some of the issues that have gone on for too long. So I urge this committee to look at this. I thank Assemblymember Considine because she's been a jewel to work with, and I do appreciate her giving us the time and opportunity to come to the table in opposition, and we urge your vote in opposition to this, and let's sit down and get something going good for Nevada so that the patients are taken care of. Thank you.
Thank you. We are going to pause for a moment. I don't see anyone in Las Vegas for opposition broadcast. Is there anyone on the line?
Thank you, Chair. There are no callers to provide testimony at this time.
We're back in Carson City. You may begin when you're ready.
Thank you, Chair Marzulli. For the record, Jesse Wadhams, W-A-D-H-A-M-S, with the Nevada Hospital Association. In the interest of time, you have heard a lot of the pieces of the opposition. We actually come at this with a concern over accessibility and the continuity of care and being able to provide the medications. The focus of this bill is on the entity not being able to pay a higher fee than the maximum fair price. It doesn't say anything about the manufacturer selling it to us for that. So we want to make sure that we have the ability to provide the medications that are necessary in that healthcare setting. And with that, I certainly will look to work with Assemblymember Considine going forward. Thank you.
Good afternoon, committee. My name is Harrison Bohn, Harrison Bohn, and I'm from Brownstein, and we represent Healthcare Distribution Alliance, HDA. We are opposed to AB 259, and we submitted a letter and should be on Nellis. HDA is a national trade association representing pharmaceutical wholesale distributors, and we do not manufacture, market, prescribe, dispense medicine, or set prices. Wholesale distributors operate under a fee-for-service contracts that are nationally or regionally focused. Applying a federal pricing policy at the state level would conflict with how the supply chain currently operates. AB 259 would cause an undue burden on our industry and patients, so we are opposed to this legislation. Thank you.
Is there anyone else wanting to testify in opposition to Assembly Bill 259? I don't see anyone. We will move to testimony in neutral. Is there anyone in Carson City wishing to testify in neutral? I don't see anyone still. Oh, I spoke too soon. Please remember to state and spell your name for the record.
Good afternoon, Madam Chair and committee members. My name is.
Is your microphone on?
The button is.
Oh, okay.
You can't hear me?
Do it one more time. There you go. Do it again.
Hello? Okay. My name is Maya Holmes. It's Mayahholmes. I'm the Health Policy Director for the Culinary Health Fund. We're a nonprofit, self-insured, self-administered labor management trust fund that provides health benefits to members of the Culinary Union and their families. Approximately 130,000 lives in Nevada. We're testifying in neutral today, but support the concept and intent of AB 259 to address the high cost of prescription medications for Nevadans by focusing on the high prices drug manufacturers charge. We are in neutral because we are in discussions with the sponsor on an amendment, and we're very appreciative of the sponsor working with us to address our and some of our coalition partner concerns. So thank you.
Thank you. Is there anyone else wishing to testify in neutral? I don't see anyone walking up. There's no one in Las Vegas broadcast. Is there anyone on the line?
Chair, there are no callers to provide testimony at this time.
Thank you. Assemblymember, would you like to give any final remarks?
Thank you, Venetia Constantine, for the record. I appreciate the time and attention and for hearing this bill again. I appreciate all of the opposition. I just think that this is a really good example of exactly where we are. The same words that I spoke to begin with are the same issues that are coming up. It'll deny access. People won't get their drugs. The mention of the fact that there are pharmacies that are now not going to stock the Medicare bill, the Medicare drugs, is something I hadn't heard before, but that certainly adds to it. I'm happy to work on it, but the bottom line is right now it's still status quo, and if we don't do anything, nothing is going to change, and people are suffering right now. And again, this bill is about the people. Thank you.
Thank you, Assemblymember, for your presentation today. I will now close the hearing on Assembly Bill 259. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. Public comment is limited to 2 minutes per person. Is there anyone here in Carson City wishing to give public comment? I see a lot of people leaving. I don't see anyone in Las Vegas broadcast. Is there anyone on the line?
Thank you, Chair. The public lines are open and working, but we don't have any callers to provide comment at this time.
Thank you. Assembly members, are there any comments before we adjourn? I don't see any. This concludes our meeting for today. Our next meeting will be on Friday, March 14th. This meeting's adjourned.